Thank you for attending today. As opposed to most of the webinars and seminars that you've seen, instead of regurgitating the information that is already out there, I'm going to be taking an approach. I'm going to be making it real, especially now that we've seen all of the clients for whom we applied for HWB program receiving an approval and money in en route, right? Checks are being issued. I'm very concerned about the speed with which this is actually developing. It reminds me so much of PPP, where a lot of people receive a lot of money right up front and were asked to return the money. It is telling me clearly that audits are coming and we should be totally and absolutely be prepared for such audits. So with that in mind, let's get started and I'll share with you as much of the making it real as I possibly can. So with that, let me share my screen and get going. New York State Healthcare Workers Bonus Program, HWB. I'll be doing the first half of the presentation, and my colleague, Roy Breitenbach, Esquire from Harris Beach PLLC, will be doing the second half. So what are we talking about exactly? Welcome to our webinar once again. Disclosure. Copies of this presentation and other resources can be found on our website. This webinar and presentation is for educational purposes only and cannot be used to contest any IRS, New York State, or any penalties and assessments. The information we are providing is based on our best understanding and knowledge as of September 21st, 2022. More information will be released on this program, which may be different from the information presented here today. We will make every effort to answer questions at the end of the webinar, time permitting. Thank you for your attendance. Let's get going. So the HWB program consists of 5 vesting periods through March 31st, 2024. The maximum bonus anyone can receive is $3,000 per employee, and that has to be done over 2 vesting periods with a $1,500 max per vesting period. The 5 vesting periods run from October 1st, 2021 through March 31st, 2024. A vesting period consists of 6 consecutive months from the beginning of the program. And as you can tell, the first vesting period is over, and now we are in full-fledged second vesting period, and we will have an opportunity to do attestations starting October 1st, 2022 through October 31st, 2022. Hence, we are meeting today to go over exactly what this entails. So we are going to go over everything in great details, but understand the spirit of the actual program. The HWB program has been put in place to reward the healthcare workers, the frontline healthcare workers that have seen us through this pandemic. And it is designed to encourage people to come into this healthcare field and to stay in the healthcare field. Obviously, we're all aware of the Great Resignation and all the issues associated with employment. And New York State's position is they need to do something right now in order to ensure we will not have a super duper employee shortage over the next however many years to come. So in that spirit, understand the key term will be frontline workers. So who is a qualified employer? The employers are responsible for applying for the bonus on behalf of the employees. So who is a qualified employer? A qualified employer is a Medicaid participating provider with an MMIS ID, Medicaid Management Information System ID, who has at least 1 employee working 20 hours or more a week and who bills Medicaid services, whether fee-for-service, Medicaid managed care, Medicaid secondary, and that has to represent 20% of their value. That is the definition of a qualified employer. MMIS ID that is valid, 1 employee working 20 hours a week or more, bills 20% Medicaid patient on their practices. That is the definition of a qualified employer. Obviously, you can go and read everything that you want about all the details and nuances, but as I said, we're not going to get into the weeds. We are going to stay at the high level. And who is a qualified employee? A qualified employee is someone providing face-to-face services or someone who was providing face-to-face services and has been moved to telehealth because of the pandemic. Now, telehealth services, as far as I'm concerned, is really not very clearly defined. If you watch a video, minute 24, it clearly states workers exclusively at non-patient buildings are not eligible. Non-patient buildings are not eligible. So we will come to that. But the bottom line is that a face-to-face worker under normal circumstances who has moved to telehealth would be qualified employee. And they must work for the qualified employer, and they must be eligible. They must have an eligible Bureau of Labor and Services worker title. And that title, you must map it to your own titles as needed. So sometimes you may call them ABC, but according to the definition, their job definition under the BLS, they should be titled CDE. So you got to have a mapping so as to make sure that you are following the rules. And they must be continuously employed by a qualified employer, i.e. you, with an MIS-ID, who has at least one employee working 20 hours a week and who bills Medicaid at least 20%. That qualified employer, you have to work for a full vesting period. That is 6 consecutive months, one of the 5 vesting periods that we've discussed before. And the base salary cannot be more than $125,000 per year or $62,500 per vesting period. Yes, they can be direct 1099 contractors, but it cannot be through a staffing agency or a temporary agency. These people are not eligible. We will come to that because clearly that's a very slippery slope when you start to go down the road of independent contractors. It's never, ever been super clear. And as I stated before, they have to work for 20 hours or more per week. So now we have defined an eligible employer, a qualified employer, an eligible employee, and a qualified employee. So let's go and discuss one aspect of the program that is extremely important, especially in the cases that are complex. We were asked this question and we'll tackle it head on. Are contract staff eligible for the bonus? Yes, if they are meeting certain requirements. And if they are, who is responsible for these staff bonuses? So for example, a hospital employs staff that falls under one of the eligible titles but are co-employed with non-healthcare entities. Are they eligible for the bonus? Permanent contract staff in eligible titles may receive the HWB, assuming that all of the requirements are met that we've just discussed. They must be in permanent contract staff. Generally speaking, that would take the form of a professional employment organization, an MSO, or some form of third-party arrangements. The qualified employer is going to be the actual entity with the MMIS-ID, not the agency or the third party that provides the permanent employees. We will come to that, but I wanted to address it right up front. That's what we consider a complex case, and we will leave this for the latter part of this conversation so that we can cover the easy ones, and anyone who wants to jump off at that point, they are able to do so because their cases are not complex. Now, the funds are sent directly to the employer, and the employer is supposed to distribute the bonus to the employees via the standard payroll processes. So from a tax treatment of the bonus, payroll and FICA taxes will be reimbursed to the employer in New York State. New York State and city taxes are exempt. Federal taxes are not exempt. Other state taxes are not exempt. So for example, your employee lives in an adjacent state, you know, New Jersey, Connecticut, Pennsylvania. They will have to pay state taxes in their state. However, I want to disclose that we are not tax attorneys or CPAs. We are simply repeating what the rule and what the regs say. If you want to get tax advice, we suggest that you consult with your legal or tax advisor. And at this point, as I said before, we have to bring up OMIG audits. Office of the Medicaid Inspector General has the right to audit any of the attestations after payment have been processed and issued. And they can do so within 6 years following the last payment. Being that the programs run through March 31st, 2024, you can get an audit all the way to March 30th, 2030. 6 years following the last payment. And if the payment is issued in April, then it will be April. If it is issued in May, it will be in May. So understand that it has to be 6 years following the last payment. And being that we're seeing the payments being dished out so fast, as I stated earlier, I'm very concerned that we will see a rainfall of audits because of the speed with which payments are being made. So let's continue and understand what an audit will look like. Let's talk OMIG audits. So since you might have seen this before, some of you on the call have already received your bonus money, right? So when you go to the HWB portal, you've seen something like this: one file process, and you have gotten $8,000, $80,000, $100,000, or $1 million in incentive payment. And you have this little button that says download. That's how you are able to download the details and know exactly how much each person received. That's great and that's wonderful. Why is that important? Well, this determines everything that we're going to be talking about in terms of an audit. So let's go. Remember, you have to document 20% Medicaid patient volume for each vesting period. Each vesting period. Now, how do you determine 20% Medicaid patient volume? Well, the reg specifically says that New York State does not dictate. That's a very, very difficult position to be in. Having done so many meaningful use audits via OMIG, through OMIG, I can tell you that my recommendation is to go with patient volume as defined under the meaningful use program. It was very, very clear. You have to take all of your encounters over the period of time, and you have to categorize which ones were Medicaid and which ones were not. Medicaid encounters were straight Medicaid, Medicaid managed care, Medicaid as secondary. And if you can add all of these up and divide by the total number of visits, that gives you your patient volume. I suggest that since we don't have very clear definition and guidance, we use what has worked before. Clearly, you could have done patient volume, or you could have done patient period, not per visit, but the number of patients seen, how many patients were Medicaid, how many patients were not Medicaid during that period. Or you could simply have done income, 20% income, Medicaid, 80% non-Medicaid. Being that the simplest and clearest and the one that has been done so many years and accepted by OMIG has been the patient volume, that's the one that we recommend. There is a specific format that OMIG requires. They provide the format, and we've been following it for the last 10 years, and it has worked beautifully. So my suggestion is that you use the exact same thing that has worked for the last 10 years, and I'm pretty sure that you'll be on the safe side. The next thing is you got to have your payroll records verification for each employee. It clearly states that the employee must work 20 hours or more per week on average during the vesting period. On average. So therefore, you have to have the record, the payroll record from your payroll processor for each of your employees during that period, during the reporting period. And it has to show clearly that they've worked 20 hours or more and they've earned less than the $62,500 for the 6 months. Now, there is very special treatment for employees making around or over $125,000 per year. Understand that if you are doing 2 vesting periods, which is what most people are going to be doing during the second vesting period, if they haven't done the first one, you may end up with an employee making $125,000 or more. You are still obligated to split the money into 2 halves, 6 months and 6 months. If for any one of the 2 6 months vesting periods, the employee falls under the $62,500, that employee qualifies for that vesting period, but not necessarily the other one. So we have to be very diligent, not treating a year worth of income, but looking at each 6 months vesting period and treating them separately. Although we are doing an attestation that is going to cover 2 vesting periods. And obviously, the next item will be the collection of the employee attestations and preservation. In case of an audit, you will need those. And the reg clearly states that these attestations must be filled out completely, must be signed, must be dated prior to the date of the attestation, and it's your obligation as employer to safeguard them. Remember, they contain the employee's social security number. So therefore, they will have to be protected because there are a whole lot of rules and regulations regarding social security number protection. Follow all those rules and make sure that the preservation is done in a manner that is legal and that will pass your OMIG audit. Another part will be the terminated employees, the past ones and the future. Remember, the rule says clearly that if the employee is with you by the time that you are receiving the actual bonus, then you are to pay that employee even if that employee leaves. In the future, it will be the same. So therefore, we will have to keep track of employees who are terminated. And remember, an employee must complete one of the actual 6 months vesting period and then leave in order for you to be able to apply on their behalf. If they leave after the 6 months and after the time period allotted for you to receive the attestation, the bonus, then you're not responsible for that particular employee. Some other employer will be responsible for that employee. Keep records to show exactly when employees left and when you were able to receive the bonus. If you were able to receive the bonus in a time frame that the employee was with you, then you are responsible. And if you did not follow through, then you may be fined. And then finally, let's talk about documentation of job functions regardless of title. Remember, the Bureau of Labor and Statistics is the ultimate guide. You have your own job descriptions. However, all the titles that go with the job descriptions as promulgated under the BLS are the ones that we're going to go by. Hence, you need to have a mapping between BLS and your own. Job function is the key. You may have to revamp your job descriptions to make sure that job functions are taken into consideration. You may have an office manager under normal circumstances who might not have anything to do with face-to-face patient care, and yet you may find in an office that office manager covers for the front desk, covers for the medical assistant, covers for the phlebotomist, because they are qualified to do those jobs. And yet their job function qualifies them while their title would disqualify them. So we have to be very, very, very clear about job functions regardless of title. Again, address your telehealth workers very specifically in their job definition, in their job functions. If they used to perform a function face-to-face that has been moved within a building that is actually where patients are seen, but these became telehealth workers, they are qualified. If you have a telehealth unit that is in some corporate park away, then they do not qualify. Be very clear as to where people work, what is their job, would their job have been done face to face prior to COVID. And finally, the employer has the responsibility to make sure that they coordinate among multiple jobs for their employees. The idea is that the employee should receive the maximum bonus allowed. If the employee works for you 20 hours and that same employee works for someone else 30, 35 hours, then you should not be the one to do the attestation on behalf of the employee. That employer should, because the employee would receive the maximum bonus under the current guidelines. So let's be very clear that as you have been doing attestations or will continue to do attestations on your own, these are the grounds that you have to cover, and you have to make sure that they're all fully documented so as to make sure you are not going to fail in Army Audit. Last word on Army Audits. They're not going to come tomorrow. They're not going to come in a year. They probably will come in 2 or 3 years, as we've seen in Meaningful Use. Remember, you will not ever have anything in place 3 years down the road to sustain an audit if you don't get them done today. You will not remember where everything is. The recommendation is you go through all those things that we just mentioned, document, put them in one place. When your door knock, when there's a knock on your door from an Army auditor, you will be prepared. Be prepared today. When it shows up in 2, 3, 4, 5, 6 years down the road, you will still be prepared. Be prepared today. We've seen so many people having to pay money back for Meaningful Use because they work with, I don't know, a company that just was a fly-by-night company, disappeared and wasn't there to help them, and the offices didn't know what to do, didn't keep any records. I'll leave it at that. Now, let's take a look at the complex cases that we talked about. If you have a professional employment organization, you have to have a legal agreement showing that these employees are contracts to an employer who is a qualified employer. If you are in an MSO situation, likewise, there's got to be a legal agreement between the MSO and you, the Medicaid provider, with the MMIS ID that shows that these employees are on contract, permanent contract with you. You have to make sure that the language in this contract is going to pass muster. It's going to meet the requirements of the rule. It's got to be making clear to the Army auditor that this is not a temp situation. This is not a temp agency. This is not a situation where people come in and out. They are permanent, and it is for other purposes that they are on the PEO payroll, on the MSO payroll, but they are working in a facility that is a Medicaid licensed facility with an MIS ID, providing frontline work and services to the actual patients. For former employees, likewise, you gotta have your ducks in a row. You have to make sure that you document their date of termination, and you have to document the date that you applied for them or you did not apply for them. And that's more important to document the date of the attestation and why you did not apply for them. When you are asked, why did you not apply for this employee, you have a very clear and succinct response to your Army auditor. Another complex situation comes from multiple businesses at the same location. I can think of a single location with a business that has an MMIS ID and a business that does not have an MMIS ID, and both businesses may be legally owned by the same people. Are you commingling employees? Are the employees from the non-Medicaid side seeing Medicaid patients? And if that is the case, then we need to look at the totality of hours that people are put into seeing Medicaid patients and not seeing Medicaid patients. The rule clearly states there is not a minimum amount of services rendered to Medicaid patients that would make someone qualified. So if someone works for you 20 hours and they spend 2 hours a week seeing Medicaid patients, you might they qualify? The answer might be yes, provided that the business itself qualifies. And the telehealth workers, again, we got to look at every case separately, but what we really want to determine are the following. Are these workers providing a service that used to be provided face-to-face prior to COVID? Are they working in a building where services are provided to the patients? Or are they working completely remotely in a corporate park, a corporate office that has nothing to do with delivering services to patients? So there are other complex cases that we can look at, but for now, you should be dropping your questions into the chat, questions related to your specific case, so that we can address them later. This is where our company shines. This is where we really provide real value. If your case is simple and you can handle it on your own, more power to you. We encourage you to do so. If your case is complex and you really want to have guidance, that's the time that you seek the guidance of people that have expertise and experience, that have done this before, who can guide you. This is the area where you really want to know you have some expert on your sides that are going to be there for you through the entire validation process, attestation process, application process, and audit process when the time comes. So get your question into the chat. As we get down to the end of the presentation, we will address as many as possible. Remember, this is a mandatory program. If you choose to participate, great, wonderful, you will cover your bases. If you choose not to participate, great, wonderful, you still need to cover your bases, because someone will knock on your door one day and ask you, why did you not participate? And you must have your answers fully documented. You gotta show to the auditor who is knocking on your door why you didn't participate. You have to be able to show them that I don't participate because I do not meet one or many of the requirements of the program. It cannot simply be that verbally I know that I don't meet requirements because all my employees are MSO. Well, that's not good enough. Oh, I don't have 20% Medicaid. That's not good enough. You have to be able to substantiate any of these statements that were made that says you are not obligated to participate. You have to substantiate, you have to document. This is a mandatory program for anyone participating in the Medicaid program in New York State. So whether you are paying bonuses or you're not, you still have the obligation to be prepared to answer the question, why did you participate? Why did you not participate? You have to pay the right bonus to the right people. No one missed or neglected or refused. They qualify, you must pay them the bonus. Otherwise, you may face a fine of $1,000 per incident. Again, yet incident will need to be defined. Incident could be per employee, incident could be per incident. I don't know. It's not very clear. We will have to find out. My hunch is, based on my experience with meaningful use, it probably is going to be per employee. So let's get to some best practices. Define and define and define. Anything that is not very clear, you need to define. And you need to have it in writing, and you need to make sure that it meets the requirements of the reg. If you cannot do it on your own, get written clarification from New York State whenever possible. There are many ways of doing this. Some of you have already done it. It may take some time, it may take some working, but at the end of the day, when you get written verification and written clarification, you have something to stand on when the audit time comes. I will tell you that back in the days of meaningful use, we had so many cases that were not very vanilla cases, and we had to get clarification. When the time of the audit, it really became our get out of jail cause, because the auditors would not want to hear it. but we had the proof that we had gone through the program, people, and gotten clarifications. Get clarifications, get written clarifications, make sure that you document them and save them. You will need those emails in 2, 3, 4, 5, 6 years when the audits come. Map the Bureau of Labor and Statistics title to the New York State list. You have your own titles, map yours to the main Bureau of Labor and Statistics titles. That's the only way you will know the job function actually meets the BLS, job description. And at the end of the day, being that we're going so fast and everything is being cleared out as we go, use your judgment based on experience. If you've done meaningful use, use your meaningful use or any other program as a guide. That's the best advice that we can have right now, because these programs are well documented. There are plenty of experiences, going through audits that we have had before, and I'm sure that you have had. This should be your guiding line. Use your judgment, use your judgment, use your judgment based on experience. More best practices. You should use a trackable employee attestation process. Why? Well, one day an employee will make a phone call, will make a complaint and say that I never was offered an opportunity to get my bonus. And you will be the one on the defense to show that you did your best effort to get the employee to sign an attestation. If you have a trackable system, you'll be able to show how many times the employee has been contacted without any answer, without any success. And at the same time, I suggest add other questions to the attestation. At least 2. Do you have any other employer in New York State? Have you received the HWB bonus elsewhere? Remember, it's the responsibility of the employer to make sure that the employee receives the maximum bonus. If you have part-time employees, this is critical. You got to make sure that they're not getting more hours elsewhere, because if they are, you should coordinate with that other employer and let the employee get the maximum bonus elsewhere. And if they have received bonuses elsewhere, remember, an employee is only allowed to receive bonus twice, 2 vesting periods. So you should ask them. Now, New York State does say they will be the ones to coordinate that. But as an employer, I would want to know that I've done my part asking the question. If anything falls through the cracks, you cannot be held accountable, responsible, but you have done your part asking the question and getting an answer, a written answer on a signed document. Final tips: if you're going to run a separate payroll, do so. Run a separate payroll with separate payroll code. That gives you an easy to run report at the time of an audit. There it is. It's very easy to show that we receive and we distributed the bonuses to all the qualified employees. Very important. At the time of your audit, this is going to be a key and critical component. You cannot receive the bonus and not pay it out. And you cannot keep the money for more than 30 days. So that will be your way of showing that the dollars came in and the dollars were paid out as per the requirements, right? You have a downloadable file that says how much each person should be getting, and your payroll report should match that downloadable file. Verbatim. If someone is supposed to get $500, you paid them $500. If someone is supposed to get $1,500, you pay them $1,500, and you rent that payroll within 30 days of the funds being received. Thank you very much. And now I am going to pass the baton to my good friend, Roy Breitenbach, who is going to be covering the legal aspect of this healthcare worker bonus program. If anyone wants to contact me, my contact information is right there, henry.denis@hitcg.com, and I will respond at my earliest convenience. Thank you all.
Henry has given you a very good overview of the entire process here, right? And a couple of things that he said are very important from a legal perspective. The first thing is document everything, right? This program was rolled out very, very quickly. There are not a lot of regulations associated with it yet. The law was passed quickly as part of the governor's budget, and so there's a lot of vagueness. And when there's a lot of vagueness, it means that when the auditors come, whether it be 2, 3, 4, 5, 6 years from now, there's going to be a lot of disputes and a lot of uncertainties and potentially a lot of gotcha moments. So there's a couple of things I really want to emphasize. The first, what I consider to be the potential pressure points with all of this, is documenting that, in fact, 20% of your volume is Medicaid, right? Now, Henry has given you the recommendation, and I wholeheartedly agree with it, that you should follow the same procedure as you do for meaningful use, because it's the easiest way to do it. So when you do that, keep a copy of your documentation. Be able to recreate it if you're ever audited. Keep it in a file and establish it. Now, you also might want to do the calculation the other 2 ways as well, right? And the other 2 ways are simply by number of patients or simply by the amount of reimbursement. And the reason why we would suggest doing the calculations all 3 ways and keeping the documentation for that is that in the case later on down the line, there's some type of a new interpretation or the government decides, notwithstanding the fact that they said they're not going to take sides as to how to do it, you have backup. It's a belt and suspenders. You could say, well, if there's a fight over some way to do it one way, you can establish it the other way. My suspicion is for many practices, you would probably meet the 20% threshold under all 3 tests. So why don't you document yourself under all 3 tests? In case there's a problem on down the line, you're covered. The second pressure point of what I'll call it is the issue of contracted employees, and that comes up with PEOs, MSOs, and I'll call them independent contractors, okay? The concept behind this, although it's not entirely clear, but if you can kind of glean from the statute and you can take it and look at what the Department of Health has said about it on all its various websites and guidelines and everything, is that a truly leased employee is somebody who is eligible for the bonus. So if you have a relationship, for example, with the PEO, where technically the PEO is the employer of your employee, but you're now leasing that employee, and you control all the incidents of employment. You give them their, you make the determination when they work, what their schedule is, their job responsibilities. You review them. You do all of that, and it's just the PEO for purposes of benefit and payroll. Well, then you're a leased employee. Not only can you give them the bonus, you're obligated under the law to give them the bonus. So you have to treat them as your employee, okay? So, what we think you have to do in that circumstance is the best way to take care of the situation without to eliminate any doubt is to make sure it is clear in your PEO contract that employee is your employee for all purposes other than the benefits and the employment, right? And of course, obviously, if you have this relationship, whether or not you get it right means a significant amount of money for you, particularly if you have a lot of employees. So we would recommend that you actually have a lawyer look at that agreement to make sure that it's properly documented. And if it's not, have a addendum to the agreement signed by both parties that makes it clear, okay? Now, the PEO relationship, I think, is the easiest one of them because it's clear in most PEO relationships that the employee is really the employee of the actual business and not of the PEO, right, in almost all cases. So it's relatively easy. The other thing you have to remember is, even though you're not the employee at law in this circumstance, right, the PEO is, you have to keep the attestation documentation, and you're responsible for making sure that the bonus gets paid, right? It may come out, so you have that obligation. And the money is going to come to you, right? So you're then going to have it documented as to how you paid it. They're not going to send that money to the PEO. They're going to send the money to you because you're the Medicaid entity, right? So you have to make sure that you follow the proper paper trail and flow in that circumstance as well. Now, when we get down to the level of an MCO, it's a little bit more complicated, right? Because in MCO, there are certain circumstances where you may also provide some employment functions for the MSO in addition to the actual practice. So again, we want to make it crystal clear that this is a situation where the MSO is actually just the entity that's employing the frontline worker, but for all intents and purposes, their employment is controlled by, they get their schedule by, and they're a permanent employee of the practice, right, of the Medicaid entity. And that should be documented in the MSO contract. And again, if that's your relationship, you need to have a lawyer look at that contract to make sure it complies with the terms, to make sure it's crystal clear, because you don't want to face an omega audit on this issue later on down the line. So we urge you to do that, right? And make sure that everything is documented. Another thing to remember is that an independent contractor relationship, a lot of practices may have a situation where they have a physical therapist, an occupational therapist, or somebody else who's not their employee but works on an independent contractor agreement. That person is still an eligible employee for purposes of the bonus if they meet all the other tests. So you have to be careful about that, right? Just because you consider them an independent contractor and they have an independent contractor agreement doesn't mean that they're not an employee for purposes of this bonus. So that's something that you have to be very careful about. The other thing I will say is that you have to be careful, and where this is a vague area is, you may have engaged a temporary staffing agency to provide you workers, right? And the relationship with that temporary staffing agency may start out where these are truly temporary employees, where they come in and out on a short period of time. They may take other assignments. Their per diems are locum tenens. But because of the pandemic and what's happened after the pandemic, even though they're employees of the temporary or staffing agency, they, for all intents and purposes, have been your employees. They're on long-term, 6 month, year assignments. You direct all their work. You set their schedule, and they're just still, though, technically employees of the staffing agency. And the staffing agency in that case is essentially just acting almost as a PEO. In that type of situation, you really have to look as to whether or not it's like a PEO and you're the entity responsible for paying the bonus, and they're entitled to a bonus. And that's something, again, that you should have a lawyer look at, you should analyze, because that's a potential situation of an exposure that you might have. So we see those as kind of the biggest, potential pressure points. Another pressure point is actual payment, okay? Making sure that when you get the money in, it's going to all employees to whom it's entitled to, right? You want to make sure you've tracked everybody down and you've documented that the money has gotten there. Because if there's one thing that OMI is going to look at first, is situations where providers have gotten the money from the state, but haven't turned around and provided that money to other, to the entities with whom they're supposed to, the employees. So that's a very important point that we really think you have to be careful about. Also, you need to track down every employee who's potentially eligible and make sure that you have the attestation forms for there. If you go on the website, it sets forth a procedure that you should follow if an employee you believe is eligible, but he or she refuses to sign the attestation clause. You're supposed to document that, and if you believe that they're entitled to the bonus, you can put in a claim for them, but you need to document that. So, with that, I'm happy to take any questions anybody has.
So the first question that we have was, can you please explain if this is just straight or regular Medicaid patients, or does this include all the Medicaid products like Fidelis, Health First plans too?
Great question. It does include the straight Medicaid fee-for-service, Medicaid managed care plans like the Fidelis, Health First, and so forth, and Medicaid as secondary. If you're going by the patient volume, that would be the patients that have Medicare as primary and Medicaid as secondary. All of them are included in calculating your 20% patient volume. Next question, please.
All right. Have an employee that was vested for the first vesting period, October 1st, 2021 to March 31st, 2022, but they left employment at the beginning of June. Are they still eligible since we did not claim the bonus until September 2nd, which is the close of the first vesting period?
Great question. So let me answer going forward, and then I will address the questions directly. So we have a vesting period ending in a few days, and then we'll have October as the time frame in which we can submit an attestation. So if an employee is with you through that process and leaves afterwards, yes, you have to apply because it falls within that month time frame. Now, being that the first vesting period is in the past, the best recommendation that we have is that the employee be contacted and work with that employee to find out what is their current situation and apply for them at that point in time. It covers your basis in the sense that that 30-day time frame would have been in the past anyway. So this is your first opportunity, and that's what we've done. In the future, obviously, it will not be a concern because you don't have a past vesting period in the past attestation. Next question, please.
All righty. Average of 20 hours equivalent to a total of 520 hours for 6 months. One vesting period.
Right. So that would be the total number of hours worked over that 6 months period divided by the 26 weeks that compose half of the year. So 2 quarters will be 26 weeks. And then you divide the total number of hours by those 26 weeks. That would give you the average number of hours worked per week. Next question, please.
What happens if my MMIS ID is associated with my SS number? I'm assuming social security number, and not my tax ID number. How do I change that? He said instructions said not to use SS number, social security number.
What I do know is that regardless of what the reg says, you are able to set up an account if you have an MMIS ID that is active. Whatever it is associated with is more of, I think, an accounting than it is a program problem when it comes to HWB. So, but I personally don't think that it will have a big effect on your ability to participate in the HWB program. Next question, please.
Okay, next question. It says, we are an eligible employer, but the regs, I'm assuming regulations, is fuzzy when it comes to the place where the face-to-face care occurred. Since the regulations state that service was provided in an institutional setting, does home care aides become eligible?
Great question.
So,
That has come up
yeah,
multiple
I could,
times. Go ahead, Roy.
home care is not eligible. Okay, home care workers are not eligible for purposes of the bonus at all. They were specifically excluded because of the belief that that there are other programs that are handling those issues. So home care workers are not eligible. You also have to be careful when you're talking about some of the provisions for location. They were specifically put in there to deal with hospitals and other facility-based entities, right? So they really don't necessarily, they really don't necessarily apply or are matched up so great when talking about, actual, regular providers, right? If you're a regular, traditional like physician practice or something, you should think of it more in the concept of who's providing direct facing patient care. And if a person is not providing direct facing care, you have to really look carefully. In most cases, they're not an eligible employee.
All right. In regards to the other question with the MMIS ID, she says MMIS is the same as your Medicaid number. So just throwing that out there for you. So the next question that we do have is, how do we pay the employees? Do we add the money to the payroll check?
It's entirely up to you. You could add the money to the payroll check, or you could run a separate payroll. It's really entirely up to you. The bottom line is that you have to be able to show that the funds were received and the funds were distributed, and they were distributed according to the actual Excel file that you were given that shows exactly how much each person qualified for and was funded.
Yeah, I would, from the lawyer in me, you do have the option to do it any way you want, but the lawyer in me tells me that Henry's recommendation about doing it in a separate payroll is a really good practice, because you're leaving no wiggle room for an auditor. You can run a report and show directly how it matches up. So there's no question to it that you actually gave the bonus as a separate payment. And I think that that's going to be, if you're ever audited, you're going to be very thankful that you did that.
All righty. So that seems to be all the questions that we have so far. Is there anything else that we should add in, Henry or Rory?
No, I mean, look, again, this is going to be an evolving area. You have to continually check back at the website and listen to Henry's updates and things like that, because there's virtually no regulations on any of this, and it's going to be a rapidly changing area.
And thank you so much for that clarification. That's exactly where I was going to go. This is an evolving program, and information is coming out every day. At the beginning, we said that this information is as updated as of today, 9/21. This is what came out today, and I'm sharing it with you to show you exactly the fluidity and the changes. So, and it, when we stated, the treatment of those bonuses and so forth, right? And read that statement. In addition, the second financial reason code FTX will appear on your remittance advice, which will represent the FACA portion of 7.65% of the total bonus amount paid on your MMIS ID. So more information is coming out on a daily basis. We did not have that when we prepared, for today. So do check back with us. Do visit the website, because information will continue to come out, and we will try to provide the service to the community on an ongoing basis, obviously, as we go through the next few weeks leading to October 31st, 2022, which is the deadline for the second vesting period. Obviously, the second vesting period covers both the first and second. So if you didn't have a chance to do an attestation on behalf of your employees during the first, now you have the attestation. You have the opportunity to do a double attestation for the first and second vesting period. That extension is automatically granted if you didn't get a chance to do it the first time around. And do remember, there are 3 levels of bonuses. For the people that work 20 to 29 hours, it's $500 per vesting period, $1,000 total. For the people that works 30 to 34 hours a week on average, it's $1,000 per vesting period, $2,000 total. And anyone who is 35 plus hours is considered full-time, $1,500 per vesting period with a $3,000 total. So with that, we will try to get all this information on the website in a short order, and everywhere we can on social media. And obviously you have our information. You can always, reach out to us. Thank you so much, everyone, for attending. Much appreciated. And if you have any question that was not answered, please just reach out via email and we will get back to you as soon as possible. Thank you all.